Dr. Ken Landa. Let's talk about Victoza. Victoza is a medicine used to treat type 2 diabetes. It's made by Novo-Nordisk, and the generic name is liraglutide. It is a recombinant DNA product that first came on the market here in the United States in January 2010 as Victoza, and the same medicine came on the market in 2014 as Saxenda, not for diabetes, but for weight control. The medicine is injected underneath the surface of the skin, pretty much like insulin. Remember, it's for type 2 diabetes, diabetes that does not require insulin. It's not a substitute for insulin that you might take during a meal. You have to take Victoza only one time a day. It can be any time, doesn't have to be around a meal. And it's injected pretty much anywhere in the arm, in the upper thigh, maybe in the abdomen. Comes in multi-dose pens. You buy the needles separately. You store the medicine in the refrigerator, not the freezer. And then once it's opened, you have about 30 days to use it before it has to be discarded. It's not recommended as a first-line drug, so you take something else for treating diabetes, and then if that doesn't work, then you can add Victoza. You can obviously look at diabetes as a failure of diet and exercise. Remember, diet and exercise, that's the most important thing. If you have diabetes, if you have type 2 diabetes, you need to exercise more and you need to eat less. If you do that, the diabetes is going to be a lot easier to control. Or maybe you're not even going to need any medicine at all. And all medicine comes with some risks. So there's a black box warning on Victoza, warning of a certain type of thyroid tumor and even thyroid cancer in people who take this medicine. Now, the studies that were done showing the high incidence of the thyroid tumors with rats and in mice, but we know that some people have developed thyroid tumors while they take the medicine. Thyroid tumors tend not to have any kind of symptoms, but if they get out of control, they can cause some swelling in the neck, a lump in the neck, they can cause some hoarseness, they can cause some shortness of breath. We know certainly if you've had a history of thyroid tumor, don't take this drug. And another kind of problem is pancreatitis. You can have fatal pancreatitis or you can bleed into the pancreas. We call that hemorrhagic pancreatitis or necrotizing pancreatitis. Severe abdominal pain radiating from the front of the belly to the back of the belly, sometimes associated with vomiting. We know that those people who have had a previous history of pancreatitis, people who drink excess amount of alcohol, people who have high triglyceride level, they seem to be at higher risk. And we know that the drug can cause kidney failure, especially if you happen to become dehydrated. So if you're taking Victoza and you suffer from nausea or vomiting, or you have some diarrhea, or if you're not drinking enough liquid, then you've got to be very careful of this particular drug. And we know that people can develop allergic reactions, sometimes quite severe allergic reactions to the drug. And of course, just as with any other diabetic medicine, if you take this one in combination with another drug for diabetes, then your blood sugar might fall a heck of a lot and you might become hypoglycemic. Now we know that if you look at overall the side effects of taking Victoza, they tend to be relatively mild. They tend to occur quite frequently in about 40% of the people, but they can reduce in incidence over a period of time. What are the common reactions? They have to do with the gastrointestinal system, so nausea, vomiting, diarrhea, constipation, and sometimes you can develop some antibodies to this particular compound. Now, should the drug be on the market? Well, according to Public Citizen, Dr. Sidney Wolf, he petitioned the Food and Drug Administration to take it off the market. He said the risks of taking the drug far exceeded the benefits of the drug. He was worried about pancreatic disease, the thyroid tumors we spoke about. He's worried about serious allergic reactions, and of course, kidney failure. How does the drug work? Well, the drug is an agonist. It acts kind of like a compound the body makes called GLP-1. And what does GLP-1 do? It makes the pancreas make more insulin. So that's why you can't take it if you're a type 1 diabetic, because your pancreas isn't going to make any insulin. But in type 2 diabetes, you can stimulate the pancreas to make more insulin with Victoza. And there's another compound known as glucagon. It is reduced, and glucagon tends to push up the sugar, so we want to reduce that. So it seems like Victoza is doing everything that we want it to do, and in addition, it decreases your appetite, it decreases your weight, and it decreases your triglycerides. And interestingly, in some laboratory experiments, it appears that it can help regenerate or stimulate the growth of pancreas cells. So that obviously is very important. Well, this is the drug, by the way, that you might remember Paula Deen was the spokesperson for up until 2013. In 2013, she had the racially insensitive language that she used, and she was taken off the air for that. We know the initial dose of Victoza is 0.6 milligrams a day. You do that for a week. After a week, you increase the dose to 1.2 milligrams. You double the dose, in other words, and stay on that forever. But if you're not really well controlled, you can increase it one more time to 1.8 milligrams. How well does the drug work? Well, it's okay. It works as good as, no better than any other kind of medicine that we have for treating diabetes. We talk about the glycosylated hemoglobin, or the hemoglobin A1C. It reduces it a little less than 0.1%. So actually it reduces it by about 0.8%, 0.8% if you're taking the standard dose of 1.2 milligrams. And if you happen to take a higher dose, the 1.8 milligrams, it might reduce it a smidgen more than 1%. When we talk about good control of diabetes, having a glycosylated hemoglobin of less than 7, Victoza only achieves that goal in about 40% of the people. If we're talking about the blood sugar instead of the glycosylated hemoglobin, well, it reduces the blood sugar by about 15 points at the standard dose, and if you take a high dose, it might decrease it by about 25 milligrams. Good news is, if you take Victoza, chances are you're going to lose some weight because of the decreased appetite. Food isn't going to taste as good. And it seems that, on average, people who take the drug lose about 4.5, 5.5 pounds. Now, Saxenda, at a higher dose, remember we said that the average dose of Victoza is 1.2 milligrams. Here, the dose of Saxenda is 3.0 milligrams. It's used for people who are considerably overweight or people who are moderately overweight who have some kind of complication like hypertension or diabetes. Now, we worry about cardiovascular disease, and people who have diabetes don't die necessarily of the diabetes. Most diabetics die of cardiovascular disease. We know that there was this drug known as Avenda, and that was on the market some time ago, and that seemed to be associated, we found out later after it had been on the market for quite some time, it was found that it increased the rate of cardiovascular problems. So what's the story with Victoza? We have two trials. One was known as the FIGHT trial, and the FIGHT trial showed that in people with advanced heart failure, taking Victoza did not make it worse. Well, that's good. And we have another trial with some information that was originally presented in March of 2016 and going to be presented in full at the American Diabetes Association meeting in June of 2016, and it showed, called the LEADER trial, it showed that people who were given Victoza actually had a reduced incidence of complications as far as heart attack, non-fatal stroke, and deaths from cardiovascular disease. So that obviously is very good. There are some other drugs that are in the family of Victoza. Victoza is a very expensive medicine. It costs about $27 a day. If you pay cash for it, it's about $830 a month. When it came on the market, it was considerably less. Even in 2013, it cost less than $500. Now it costs $830. If we talk about the Saxenda, that costs almost $1,300 a month. Now you might say, well, geez, those prices are very important because we have to have the drug company having enough money to manufacture some new kind of medicines. Well, let me tell you something. The drug company, Novo-Nordisk, just in the fourth quarter of 2015, made well in excess of $1 billion profit. $1 billion profit to make a drug that costs a heck of a lot, that doesn't do any better than any other drug for diabetes on the market. Well, what should you do? I'll tell you what you should do. If you have type 2 diabetes, you should go on a diet, and you should get some exercise. And after you do that for a while, depending on what your sugar is, then you should consider starting all of these medicines. But right now, We're spending almost $400 billion to take care of type 2 diabetes here in the United States. That's a heck of a lot of money for something that can be adequately treated in the overwhelming majority of people with diet and exercise. Anyway, thanks for watching. I'm Dr. Ken Landau. Talk again soon.